Oakley here wants you to know that if you grind your teeth, we have solutions for you. Hi, I'm Dr. Langston. I'm a prosthodontist and owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. And I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
This is Oakley. This is our therapy dog. She's kind of got a little cult following. We have a lot of patients that love coming in and saying hi to her. She's always available to come in if you're nervous, anxious. Just basically takes the edge off, makes everybody a lot more comfortable. So let's get back to the topic at hand, teeth grinding. The majority of people grind their teeth at night, so it's a subconscious thing. Most people aren't aware of it. Other times you might grind your teeth are stressful situations. So I have patients that grind their teeth when they're driving, or if they're at work working on the computer. They don't think about it, but they're just clenching and grinding. And teeth weren't really designed for that. Teeth are designed just to do the function and the chewing. And so when you're putting a lot of stress and duress on them, you can actually cause microfractures, cracks, and break down fillings and crowns, and a lot of especially aesthetic work on the front, because the front teeth aren't designed to do that work. They're designed just to kind of cut the food, send it to the back. So if you're grinding and clenching and really banging around on those teeth at night, you can do a lot of damage. So one of the things we do in our office that I highly recommend for almost all patients is a night guard. And night guards of the past were big, they were bulky. You put them in and you can't talk. You've probably seen lots of movies make fun of somebody putting their night guard in and just drooling all over themselves. The ones we have today are a lot sleeker. They're smaller. Typically we put them on the top teeth so they don't touch the roof of your mouth. They're totally just on your teeth. And the inside is designed so it's softer. So when you put it in, it kind of nestles into place so it's sturdy. And then the bottom part is a hard acrylic. And what it's done, we build it so that when you move your teeth around, you guide in the right plane. And so what I always tell our patients is your back teeth were only designed to kind of grind up and down. And so whenever your back teeth touch, you fire off the muscles of mastication, the chewing muscles. And the big one is right here, and then the temporalis up here. And so the problem is, in the middle of the night, if you're grinding and those back teeth are hitting, so you're going to wake up with fatigued muscles. I like to tell patients it's almost as if you're doing bicep curls all night long. You wake up in the morning, your arms are going to be shot. And so the jaw is no different. It's a complex joint with these big muscles. And so if you're waking up in the morning, stress, tightness, soreness in your jaws, there's a good chance you're grinding or clenching at night. And so what the night guard does, it changes the way that you bite and grind and move around so that the second your jaw goes left or right or forward, the night guard disengages your back teeth. And so you're doing all the guidance on your front teeth, which is the way the body was designed to be. So you can move your jaw around and attempt to clench and grind all night long, but the night guard is going to prevent you from firing those muscles off, and it's also going to protect your teeth. Any case that we do a full mouth reconstruction or any aesthetic work, whether it's veneers or crowns on the front teeth, we always make a night guard. And I like to tell people it's basically you're protecting your investment, because a lot of that work is an investment of your time and money. And the last thing you want to do is wake up in the morning with the chipped front tooth after you've got this beautiful smile. We've created this wonderful look, and you wake up in the morning and it's chipped and broken. It's not the end of the world. We can obviously fix it, but it's better to prevent. It's one of those, an ounce of prevention is worth a pound of cure. So because most of the clenching and grinding damage that happens at night when you're not aware of it. So the term night guard is a little bit of a misnomer. We like you to wear it at night, obviously, to protect your teeth when you're sleeping and you're subconsciously grinding around. But anytime during the day, absolutely, there's no harm in wearing the night guard, because they're designed to protect all your teeth. So if you find yourself in a stressful situation, typing on the computer, having to write a stressful email, driving anywhere, just pop the night guard in. You might not be able to talk very clearly, but at least you'll protect your teeth. The dental term for grinding your teeth is actually called Bruxism, and there's a lot of different reasons for that. Most of the time, it's just a subconscious movement of your jaw and clenching. Generally, it's associated with stress and turmoil in your normal life. So I know nobody can be stress-free, and a lot of times we carry that stress in our shoulders, in our jaw. So it manifests itself overnight with your subconscious trying to kind of release some of that tension and stress. Bruxism can also be caused by sleep apnea. There's a lot of research that shows that's your body's attempt at waking you up. So if you're sleeping and you're apneic, you're not getting enough oxygen, your body will actually clench to fire off those muscles and try and wake you up so you'll take a breath of air. Because a night guard is a medical device, it's not inexpensive. There are cheaper over-the-counter night guards that you can make that you can boil and bite, and those are okay if you have minor clenching or just a small case of of stress and you want to use it for a short time. But unfortunately, they're not designed in a lab, and they're not made to protect your bite like a custom-made night guard is. Some other things that you can do if you're on the border of needing a night guard and don't want to make that commitment, you can stretch, you can try and reduce stress in your life. Meditation, yoga, these are all things that kind of calm and relax you down. But sometimes those aren't enough, and that's when you need to see us, and we can make you a custom night guard. I'm Dr. Brett Langston, and this is Oakley, and we're here to help you watch your mouth.